Hey, welcome back, everybody. Dr. Greg Eckel, and this is What the Health. And I have a treat for you. We're going to talk multiple sclerosis and the state of the research and ongoing research with Dr. Terry Wahls. She is an Institute for Functional Medicine certified practitioner and conducts clinical research using functional medicine principles in the setting of multiple sclerosis. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contributions in research, clinical care, and patient advocacy. Dr. Wahls has secondary progressive multiple sclerosis, which confined her to a tilt recline wheelchair for 4 years. So she knows this disease process intimately. She restored her health using a diet and lifestyle program, which we also utilize with our patients. Thank you, Dr. Wahls. And she designed specifically for her brain and now pedals her bike to work every day. She's the author of multiple Wahls protocol books, which we will have links to in the show notes, and a cookbook to boot. And I'm going to also really highlight today, and I'm going to really get into it with Dr. Wahls on her research and enrollment. Welcome aboard, Dr. Wahls.
Hey, thank you for having me.
I am so excited. I always learn so much with you on the show, and I love sharing your information with our audience. Um, let's start out on just kind of the personal story behind Dr. Wahls for those
Yeah.
that are new to What the Health. And you suffered with multiple sclerosis, as I said in your intro, and severe pain. So
Mhm.
tell us how you got here today.
So during medical school, that was back in 1980, I started having twinges of electrical face pain that would ultimately be diagnosed as trigeminal neuralgia. That would be progressively more severe over the next 20 years. I then developed weakness in my left leg, and I see a neurologist and am diagnosed with relapsing remitting multiple sclerosis. And he says, by the way, we saw you had an episode of dim vision 13 years earlier.
Hmm.
That was probably optic neuritis. And did an MRI of the brain, the spinal cord, and a spinal tap. So I had a lesion in the brain, one in the spinal cord, and abnormal spinal fluid consistent with multiple sclerosis.
Hmm.
I start reading the basic, the research on PubMed. It's very upsetting because I see it's a progressive disease
Right.
that within a very short time, people are unemployed. So very distressing. My family convinces me to stop reading the research, that we'll
Yeah.
go find the best MS center in the country. They can take care of you. We did that, took the newest drugs. But within 3 years, I'm in a tilt recline wheelchair. And it's very clear that, if I think of the 20 years I've already had with my trigeminal neuralgia, that I clearly have a progressive illness. And so I go back to reading the basic science. I decide that mitochondrial dysfunction are what's driving disability. I create a supplement cocktail for my mitochondria, which slows my decline. I'm very grateful. I'm still declining. I discover a study using electrical stimulation of muscles in people who are paralyzed, who are never going to walk. And I convinced my physical therapist to give me a test session. Hurts like hell, but when it's over, I feel great. And so we add electrical stimulation to my regimen. I'm doing this tiny little workout, 10 minutes every morning before I go to work. If I do more than that, I can't work. Now, fortunately, my brain is still clear. My trigeminal neuralgia is relentlessly worse. My chief of staff calls me in and tells me he's reassigning me to the traumatic brain injury clinic. I'll have to go there in January. Describes the job. I'll be seeing patients without residence. And I'm like, there's no way I can, in my head, it's like, there's no way I can do that. But I'm doing my electrical stimulation. I discover the Institute for Functional Medicine. I take their course on neuroprotection. I have a longer list of supplements, and they talk all about the mitochondria. And then I have this big aha, and Greg, I laughed at how long it took me to have this. What if I redesign my paleo diet based on the supplements I'm taking? And so I do some more research to figure out where these ingredients are in the food supply, And I've redesigned my paleo diet to maximize the nutrients I was taking in supplement form. And now I start this new way of eating December 26, 2007. At that time, I'm unable to sit up. I'm in a zero gravity chair with my knees higher than my nose. That's how I see patients with or staff the resident clinic. That's how I interact with my family at home. I can take just a couple steps with 2 walking sticks. Otherwise, I'm in the tilt recline wheelchair. I'm beginning to have brain fog. As I said, my trigeminal neuralgia is relentlessly worse. So it's clear to me I'm on track to be bedridden by my illness, probably demented in due time by my illness, and possibly dying with intractable pain. So I start this new way of eating. Then January comes and I have to go to the traumatic brain injury clinic. The first 2 weeks, I watch my partners. The third week, now I have to start seeing patients. And, I come home Monday night and I tell my wife, Jackie, that wasn't too bad. And at the end of the week on Friday, and I come home and say, I think I can do this. And honey, could I sit in a regular chair for supper? So we swap out my zero gravity chair. I sit in a regular chair and I eat supper. First time in years, I'm having supper with my family.
1 week on the diet?
Well, no. So I had been, following a paleo diet for 5 years.
Okay.
I had over the summer added electrical stimulation of muscles.
Got it.
That and then over the fall, I did my research. Where are these ingredients in the food supply?
Got it.
So now I restructure my paleo diet based on mitochondrial needs.
Yes.
And 3 weeks into this, actually, it's probably about 4 weeks into this, I'm saying I want to sit up at a regular chair for supper, first time in years. And my physical therapist says, Terry, you're stronger. And he has me doing my exercises 10 minutes twice a day, then 15 twice a day, then 20 twice a day. And so that leads to my starting to walk in the hallways at the hospital with my 2 walking sticks, and then with 1 walking stick, and then with none. And then on Mother's Day, we have an emergency family meeting because I want to ride my bike, which I haven't done in 6 years.
Wow.
And so Jackie tells my son, who's 6'5" and he's 16, Zach, you run alongside on the left. She tells my daughter, who's 13, Zeb, you run alongside on the right, and she follows. And I bike around the block. My son is crying, that big 16-year-old boy. My daughter, the 13-year-old, she's crying. Jackie's crying. And if I relive that moment, the tears come again, because that's when, that was the day hope comes back. Because if you have progressive neurologic disease, you let go of the future. You just take each day as it unfolds. But then it's like, how much recovery might be possible? So I'm biking a little bit more every day. In October, Jackie signs me up for the Courage Ride, 18.5 miles.
Wow.
And when I cross that finish line, once again, we're all crying.
Yeah.
And this, fundamentally changes how I think about disease and health. It will change the way I practice medicine, and it will change the focus of my research.
For sure. And, thank you so much for sharing your story. And I could hear that really every day. It's so inspiring to hear what you went through and the resolve, right? Because it was 5 years prior that you changed your diet, but you didn't really get those results to get the drive. What was it in you to allow you to stay
the
at
course.
it? Yeah.
Being a mom, having 2 kids.
Sure.
Because my kids are watching. And so that I could either give up, and there was plenty of despair. Clearly I had a very difficult diagnosis. Things were getting relentlessly worse.
Yeah.
But if I gave in, I'm teaching my kids that when life is difficult, you give up.
Yeah.
Or I just keep doing the best that I can, doing my little simple workouts, which were getting, of course, smaller and smaller and smaller.
Right.
And that my kids had chores, which they both complained bitterly about, particularly when they were 10. And then I'd say, well, yes, it's not fair that you have chores and your friends don't, but um, my chore is to go to work. Your chore is to do the laundry.
Right. Right.
And so, my 10-year-olds would stomp their feet and say, Mom, I think you're glad you have MS so you can lecture me about chores. And now they're horrified that I tell that story. But, that's age appropriate for a 10-year-old.
Indeed.
But knowing that my children were watching and that I had fewer and fewer tools to teach them how to be successful adults.
Yeah.
So, and my tool was that, well, I'll do all that I can. And I'm not going to complain. I'll do my little workouts as best I can. I
I
was
love
doing
it.
my paleo diet, eating as well as I could, as I understood,
Yeah.
taking my supplements. Because I figured out if I didn't take my supplements, my fatigue was worse. So, like, okay, I've said,
You
that's good.
noticed that worked.
And then I'm doing the electrical stimulation.
Yeah.
And my in the Matrix, the movie The Matrix was out. So my kids thought, this is sort of like the Matrix. You're rebuilding your muscles. I said, yep, this is exactly like the
I
Matrix.
love it. Hey, before we go too further, there's a little bit of a static or grumbling with the microphone. I just want to make sure that we get that cleared up.
You know what? My Ethernet's not plugged in, so let me go take care of that.
Okay, I'm going to pause this.
Okay.
Perfect. Well, it is your story. You're living it. You're inspiring. Thank you, and keep shining brightly. And that's what I love about you. You're also doing some amazing research as a result
Yes.
of all of this. So, will you share where you're at with that?
So we're doing a trial called Efficacy of Diet on Quality of Life. It is comparing a ketogenic diet, a Paleolithic diet, to usual diet. People come to Iowa City. We get all their baseline assessments. Then we randomize them to one of those three diets. We uh, give them some support to adopt those diets. They come back in 3 months for another visit, then come back at a 24-month for a final visit. This will be the largest, longest diet study in the study of MS. It will have MRIs. We are super excited. We are recruiting 156 people. We've got either 129 or 130 randomized as of today. And so we have 26 more to get in. I am super hopeful, Dr. Greg, that you can help me get those last 26.
I'm going to pull out the
And I'll,
pom poms.
well,
We're going to
that's
do
right.
it.
Well, we'll get you the links. You can go to terrywahls.com/MS study. We have a little video that tells you more about the study and a link to screen. When you complete the screen, you'll be asked if you want to be part of our database for future studies, because we do some studies that don't require travel, that are virtual only. This study does require travel. You have to just be willing to come to Iowa. You can live in Canada, the United States, or Mexico. But key, you have to be willing to come to Iowa.
Got it. And that's for 2 trips, 3 trips?
3 trips.
3
Month
trips.
0, month 3, and month 24.
Perfect. And the criterion, because I have heard actually from some of our patients that they didn't qualify. So I was wondering if there's specific criteria.
Yeah, so a couple of things. If you screen and you're sure you should qualify, but you didn't, please email us, because there's no back button. People sometimes, make a mistake filling out the form.
Okay.
We need you to be between the ages of 18 and 70, have relapsing remitting multiple sclerosis. We also, if you have had your gallbladder out, or if you've had oxalate kidney stones, you can't get in. If you have clinically significant heart disease, liver disease, kidney disease, you can't get in. If you've had a history of an eating disorder and you are currently anorexic or have bulimia, if you have difficulty with severe depression, schizophrenia, bipolar, you can't come in.
Got it. Awesome. Well, we'll definitely be sure to highlight that in our emails and in the show notes here.
Yeah, that'd be
Um,
super helpful.
what what have you been finding in the research? There was recently some dietary interventions with MS that got published. I'm wondering what that was
Yeah,
showing.
so there was a recent study that looked at wheat in a mouse
Mm,
model of MS and wheat consumption in a human clinical trial. It looked at the impact of eating wheat on immune cell function. And they saw that while gluten is a protein that's in wheat, but there are several other proteins in wheat,
mhm.
and that it's not just gluten that is the problem. In that a low wheat diet compared to a higher wheat diet in the mouse and in humans had differences in the activity of the immune cells and the reactivity. So the presumption is we're beginning to understand the mechanisms of why a gluten, a high wheat diet may be a problem, and a low wheat or a no wheat diet may be beneficial.
Interesting. Do you know, were they using organic wheat in the study or?
That I can't comment.
Got it.
Yeah,
Um,
and I can't comment. Was sprouted wheat less a problem than
right,
non-sprouted wheat? These are nuanced issues.
for sure.
Now, there's another study that we just published, super interesting. This is a quasi-experimental design. That means that people can choose to be in the which arm they're in. And the two arms were taking DMT, standard of care in newly diagnosed relapsing remitting MS or clinically isolated syndrome on a DMT, or newly diagnosed clinically isolated syndrome in newly diagnosed relapsing remitting MS had declined a DMT. So taking no disease modifying treatments. In that arm, we taught them a modified Paleolithic diet, a 478 breathing meditation, and a brisk walking program. And we followed them for a year. Now, this study was due to start enrolling in March of 2020,
Hmm.
which meant we had to immediately rewrite our protocols into a virtual study,
Yeah.
which we did. And so we were able to use validated quality of life questionnaires, fatigue questionnaires, mood questionnaires, and mental clarity questionnaires. And then we abstracted medical records for adverse events, for relapses, and compared the two groups.
Wow.
So the question we were asking was declining DMTs and using basically the Wahls protocol, a modified Paleolithic
Mhm.
diet, meditation, and exercise, not inferior to standard disease modifying treatment. And so we're comparing these two groups. Not to say that the lifestyle was better, we just want to say it was not worse. We went to the research to say what are the limits that would say that for each measure, the measure was equivalent. And then we ran those proposed limits by the study neurologist to be sure he agreed. And so the statistician, the neurologist blessed the limits that we used.
Hmm.
And what we found is that, in fact, for quality of life, physical quality of life, for fatigue measurements, for anxiety, depression, and for perceived deficits questionnaire, that's mental clarity, diet and lifestyle was not worse
Hmm.
than disease modifying treatment. Now, the other thing that we did was we captured how many relapses occurred, and we found that we had 4 relapses in the folks in the health behaviors arm, and 1 relapse in the DMT arm. we should keep in mind that according to the research, published research, you anticipate zero point 0.7 relapses per year if you're not on DMT.
Mm,
So we had 29 people in, you would have predicted 17 relapses.
yeah.
We only had 4.
Wow.
So certainly the health behavior group did have more relapses than the DMT group. Uh, However, for those people who can't take DMTs, they're trying to get pregnant, they delivered and they're breastfeeding, they don't want to take a DMT while they're breastfeeding, or that they're having adverse responses to the DMTs, that health behaviors, so this is the first prospective report on what happens taking no DMTs and just using diet and lifestyle. It's not as good as DMTs for reducing relapses and
Relapse.
enhancing lesions,
Yeah.
but it's certainly very much superior to eating the standard American diet, doing nothing, not meditating, and not taking an active compound.
Wow. That is awesome.
It's very positive.
That is very positive. That lifestyle modifications, which, it's interesting to me growing up in the naturopathic Chinese medicine world, where it's ingrained in the philosophy and the education that, of course, it makes sense, right? But it's nice to have the research to support it.
Well, absolutely. And you won't be able to do a randomized controlled trial, but at least we're able to get a prospective look
Mhm.
at what's happening. It would have been lovely to have gotten the MRIs. It would have been lovely to have
Sure.
gotten the clinical assessments, but
Yeah.
such is life. You have to be willing to adapt.
Yeah. You, at the end of the show, or I'll just share it now. There's a great new mitochondria test coming out on the market called Me Screen out of UCSD and Hamel Patel, which I will make an introduction for you because I know that you will
Yeah.
be very interested in it. I'm very excited for the research that we're setting up here at the Energy for Life centers or with regards to that, some questionnaires, et cetera. But what has surprised you in the research that you've come across lately?
Um, well, actually, one thing that was super interesting were the number of retractions
Hmm.
that were happening in the cancer world. Is a huge deal that peer-reviewed, published
Mm.
research that is used to justify FDA approval for a bunch of these very costly cancer drugs, immune drugs, and there were 31 papers that were affected that
Wow.
are retracted. That's a big deal,
That is a big deal.
and doing research, making sure that you have a good statistician to do the stats, that you are rigorous in your process is important.
Yeah. How do you manage that as clinician and researcher? I know
Well,
you're growing in this realm, but yeah.
so one of the things that we do, because my university and probably the world assumes that I have a conflict of interest
Mm,
because I write books, I create programs to teach clinicians and teach public how to improve their diet, and I do that for a variety of diets. So people are afraid that I may have a conflict of interest if I do research about diet and lifestyle interventions. So we always have I always disclose there's maybe a perceived conflict of interest. I have to fill out the circumstances. The conflict of interest research committee review all of that, and then they devise a plan. And the plan that consistently gets devised is that we end up with 3 people doing stats.
mm.
One person who cleans all the data, hands it over to the statistician, who will analyze the data and write a report. And as part of the manuscripts, every manuscript that we generate, and that statistician is masked to diet assignment. And then a third statistician reviews his analysis and writes a report to either disagree or confirm.
Mm,
This is, and of course, I have no contact with the data.
right.
I just designed the study, and my postdocs write the manuscript. They write the first draft. We give them feedback, and we disclose on all the manuscripts, the websites, the courses I teach, blah 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 blah, and the diets that I follow. So we try to be as transparent as possible with the university, as transparent as possible with the publications, and that we have 3 statisticians
Right.
on the study. Now, fortunately, my postdocs can act as a statistician and do the data cleaning. And then we have 2 senior statisticians that do the analysis and then the overview of the analysis.
Got it. Yeah. So you've got a robust institutional team there, which is
To make sure that what we're doing is fair and honest
yeah. Yeah. And good research, right?
and good research.
Yeah. What I recently saw you give a lecture on modified citrus pectin. Is this something that you've been
Yeah. So, there's a compound called galectin-3 that can make a polymer, and that is part of a biofilm that can lead to damage in our tissues, damage in the gut, the microbiome. And modified citrus pectin is you might think of it as a cleaner that can wash away the galectin-3 biofilms. It has some really nice research in the setting of cancer. It has good research in the setting of microbiome problems. And for people with autoimmunity, microbiome problems drive the disease process.
got it. So, and that would be at the heart of multiple sclerosis.
It's at the heart of MS. And if you think of the systemic autoimmune conditions, lupus, RA, inflammatory bowel disease, there's often a component of severe fatigue, of anxiety, depression, some brain fog. These are neuroimmune symptoms. And I would say most of our autoimmune diseases will have some component of neuroimmune symptoms.
Yeah.
So MS is the one that we classically think about.
Yeah.
But we have 3 million people with Hashimoto's who have cognitive issues.
Yeah.
All of those people are having neuroimmune symptoms.
For sure. Is there any concern with it kind of leaching out beneficial minerals or vitamins, or it's really specific to biofilms or modulation
Well,
of the
I'd say it's really specific towards biofilms.
yeah.
I think this is probably much safer than clay, zeolite. And so for detox support, I really like this. For microbiome support, I really like this.
Love it. And is there anything linking it with mycotoxins or beneficial use there?
I've not used it myself in the study of mycotoxins, although I anticipate that it would be helpful because I know the lime stocks
Yeah.
will use a lot of pectosol
Yeah.
or the modified citrus pectin for lime.
Perfect.
So I am thinking the people who are treating mold likewise are probably using it there as well.
Yeah. Well, this has been awesome as per usual with you. Any action items for folks that have made it to the end of the interview today?
Well, the first thing is please screen for our clinical trial and be part of at least our database for future trials. We also have studies that are involving cancer-related fatigue, fibromyalgia, and long COVID. And Dr. Greg, I'll make sure you have those links.
Yes.
And those studies are all virtual, so you don't have to come to Iowa. You still have to be a Canadian, American, or Mexican, but you can participate virtually. So please be part of those studies as well.
Awesome. Well, Dr. Wahls, it's always a pleasure. Thank you so much. You all, viewers and listeners of What the Health, if you got something out of today's show, please go out, give us a 5-star review, and put down what you're going to take. What are you sharing with others? This is where the information comes from. That's what we have. This platform is for you. Yes, you listening right there. So thanks for tuning in, and we'll see you real soon.